all right? Can't hear you. Yeah, try again.
Yeah, okay. Is this, yeah, can you hear me now?
Yeah, now it's crystal. Perfect. That would have been a bit of a blow to everything. So welcome, Alex. We've got quite a few people joining in, and we're doing lips today. I think certainly for me, I've been focusing on the coronavirus for the last few weeks. I don't know if you've heard of it. It's a virus that's been going around. Yeah, you might have. You might have. Yeah, that's why you haven't been getting out much. Yeah.
It's all the airspray we're having instead. I see Dr. Natasha's joined us again with a drink this time as well.
Great. There's there's a really nice mix already on here. We've got I think Tarina from Vivasi, who's I'm not going to talk brands today, but actually I do use their brand, Steelage, love it. We've got Dr. Harris, who is amazing, has some amazing techniques with lips. And we've got, I know, some of my patients joining as well. I know you've had questions, Alex. I've had some posted to me. And we discussed the other day that we could both just rant about lip fillers and all the bad things that are done. But I think we touched base earlier and we said we will do it slightly unscripted, but we do obviously need to talk about that, the elephant in the room. But we also want to talk to those out there who haven't had lip fillers, who maybe would like slightly fuller lips, but are too worried about looking like those accidents, and to reassure them that actually through all the negativity we might bring today, there is actually that you can definitely have a natural result if you go to the right person. Yeah. So, Alex, can I kick off? So when one of the things we've put in the post is things people should be told. So to you, me, and medics out there who do this will just seem like common sense. But just what are the key things people should expect as part of their experience with lip fillers?
So I actually get quite a few people who it's their first time filler experience with me, actually. So it's quite nice to have somebody who hasn't been tainted yet by some bad experiences like I've seen through Botox and other fillers in the past with people. So quite often I will spend longer than the actual procedure just having a good talk with people beforehand. So the consultation part. We cover all sorts of stuff. So first of all, it's just, I think, spending a little bit of time speaking with the patient. You get a little bit of rapport. You kind of get to know what they're about. They get to know kind of what you're about. Make sure you're on the same page. Make sure that you're kind of feeling comfortable with that person to do your treatment, vice versa. So I think that initial stage is so important, just to make sure you kind of both click on the same page. Then quite often we'll go over obviously what the procedure involves, how what filler is basically, because again, a lot of them haven't had it before. So we explain what the filler is. We go over all the different types of filler, so we'll probably touch on those a little bit later on. And then what they're kind of looking for, what they want to achieve by this, so what they want to get out of it. Are they looking for just something a little bit subtle? Are they looking for that slightly more definition? Are they looking for a pout out here? In which case I might send them to you or somewhere else. But I think it's important to make sure we get an understanding of what that patient is actually here for. And sometimes it's not actually the best treatment for them. It might be that they've come to you saying, "Oh, I want my lips done," but maybe it's something else. Maybe it's, I don't know, chin, cheeks. It might be that they don't need anything at all. They've just had, I don't know, a bad breakup. And that's why it's so important not to rush this initial consultation stage, because that's when some very important decisions are made. And if you just kind of barrage through it, right, you're here for lip filler, get on the chair, whack it in, then all that important stuff is missed out. And I think that's where patients start to dislike their results.
And that's I think we all, the key thing that many people feedback is sort of, often had fillers elsewhere, and they say, "Oh, I just got onto the couch within 5 minutes, had it done." And I know you were coming to that, but just so people don't think we've missed it out, you know, you should have a consent form done, photographs.
It's scary.
Yeah.
Their face changes quite often. They'll go white. So what we'll do, as part of the whole procedure of explaining what the fillers are, I'll make sure they're fully informed, and I don't make it pretty for them. There is a risk. I mean, the common stuff: swelling, bruising, lumps and bumps, those sort of things. But then the scary stuff that we see a lot in the newspapers, the necrosis, the bits where people's lips drop off, all infection, scary things like that. I think if the patient isn't fully informed about that, then you can't make a valid consent. And as a doctor, that just goes against everything we stand for, really. So I have quite an in-depth consent form. Quite often people who again have been elsewhere, they're like, nobody ever mentioned that before. Nobody told me about like the arterial occlusion or all the other stuff could go wrong. And I'm like, you're having like a needle and a foreign substance inserted into your lips, and they've not gone over these, and it's quite scary for me.
That's the problem, isn't it? And one of the key things is that if as a culture, as a society, and I think we've got one of the worst situations going on in the UK. I'm sure you have as well. I've got medical colleagues and aesthetic medical colleagues around the globe, from India, Australia, US, and it doesn't matter what country. It's not just Western, you know, rich, developed countries. It's countries around, even in Africa, and they're amazed at the UK. That, you know, a lot of countries look to the UK as, you know, one of the leading countries when it comes to things like medicine and healthcare and regulation, and they're amazed that it isn't against the law for, as far as fillers. It is for anti-wrinkle injections, of course, as you know, because they're licensed medicines like Botox and other brands. But for fillers, there is nothing in the law to stop anyone doing it, and so it's considered like a beauty treatment.
Yeah.
But then you get the results that we're going to talk about and the complications that we're going to talk about. You put in a post recently, 83% of complaints, I think it was 83% of complaints to Safe Face, which is a regulatory body, were from cases where the practitioner had been non-medical, i.e. a beautician or your gardener or whoever else decides to pick up a needle. And it is alarming. And, you know, your clinics are full, my clinics are full. It's not because we're bothered by, you know, a lack of patients coming through our door or competition. It is merely that people are just not, I don't know why actually they're not aware, because there's enough out there now to warn people against it. And I'm going to talk to you later about promising, but we can move on for now. So yeah, so just what you've described is a very thorough, you know, before you've even considered getting the needle out, and as you've said so many times, they're not even that's not gonna be the best thing for them. That's almost a smaller part of it, the actual injecting. Would you agree?
Yeah, it's all the build up and just making sure that they're completely happy with the decision, they understand everything that's involved, that it's not just a one-off treatment with me, and I'm sure with you, it's quite often either the first step of a kind of treatment plan, or it's just part of a journey. And again, it's not like a kind of throwaway inject it. It's something you should have this relationship for, that you're happy to continue it through, because the filler doesn't last forever. It'll need topping up. It might be, again, that you've built in some of the treatments into the plan, and it's about building it up. So yeah, in summary, for people who've not been before, you arrive, consultation, long chat, consultation form. We take a few before and after photos, and then when all of that is kind of done and dusted, it's only then, right at the end, they actually get on the couch. We start to do the injection. So it's a lot more involved than I think some people make it out to be, and experience other places. So I mean, we've touched a little bit on kind of the patient journey and how they're involved. But I know that you're quite keen on like the psychology and things behind beauty and the patients as well. And you mentioned the save face stats as well of complications. I think earlier, was it yesterday? I think I've got a picture in here. I'll see if it comes up. We've got things like this being posted up. I can't remember, she said she had like 20 syringes injected or something. But that was her idea of beauty and what she aesthetically wanted to achieve, which I think to a lot of us is quite shocking and probably not something that we would necessarily put our ideals on. But then I suppose who are we to judge? So I know you're a lot into the psychiatry, the psychology of beauty and things. What do you think about sort of people who, perhaps in our eyes, the lips are a bit overdone?
Yeah. So first of all, yeah, as you said, ultimately, if someone still, knowing what they know, wants to go somewhere where someone's prepared to make them look like that, then that is their prerogative. Yeah. If I think, assuming there aren't other psychological factors that, you know, and they're basically a very vulnerable person being taken advantage of. But other than that, people have a right to do what they want to do. However, you know, I mean, Steve Dunn talks about this very well in one of his books, that you know, people often, when they come in, I often say to them, why are you actually having this done? Why do you think you need your lips done? And actually, you're asking almost, you're trying to tap into their subconscious mind, because they would generally say, you know, if you've got a fresh-faced young person where there's no jowling, there's nothing else really going on, and whether their lips are thin or not, they'll say, well, I want bigger lips.
Yeah.
And when I whittle it down, whatever they come in saying, my jowls, I look like I'm frowning, I look angry, I look sad, my skin looks bad, I look tired. Ultimately, we're all doing it to look more attractive. And when you say that, some people might say, oh, no, I'm not vain, or no, it's for myself. But if you were the only human being on the planet, you wouldn't care. You know, the reason is because we live within a society, we have mirrors, and it feeds into how we feel. And attraction, and when I talk about attraction, I just don't mean sexual attraction. I mean, you know, if I go into Currys to buy a fridge freezer, I need to have some sort of strike a relationship with the person serving me. Let's call him Bob. And there needs to be some attraction between Bob and me. I'm not talking sexual attraction, I'm just talking as two human beings, to allow us to have a productive interaction. And so the more attractive we are to people around us, just as a human being, the more productive our life is, the better the outcomes in all avenues. So, and that attraction, one major component, which has been shown by many psychology studies, is the mathematics of beauty. And that is when, as you know, something so many people don't do with lips, their faces are not even turned, you know. And you know, we look at various lines, Ricketts line, we look at a whole load of different relationships to see the relationship of the nose, the chin, the upper lip, lower lip, to know whether, you know, am I going to make this person look like Marge Simpson? If I am, let's do the chin first. Yeah. And you mentioned chin earlier. So that's the mathematics of beauty, and so often that's overlooked. So already those people are going to end up looking bad, whatever is done to their lips, and they're going to be de-beautified, not beautified. And so that's the first thing. But then there's two other big things. There's genuineness, how genuine you look, and your confidence. So if I walk into a room head down, a bit down, I'm not going to look as attractive. But actually, it doesn't matter what my mathematics of my beauty is. If I walk in confident, you know, not overconfident, not cocky, but confident, immediately there's more appeal. Yeah. So when people like her have their lips and they're overdone, if they feel good with their lips, whatever the reasons, then you could argue, well, their confidence goes up, and therefore slightly that's going to push up their attraction. Fair enough. But of course, the two other things have been diminished. The mathematics of their beauty has been diminished because the maths is all wrong. And genuineness, clearly that's not a natural looking set of lips. And if it's not a natural set of lips, then you have no genuineness. And so as you know, anything, whether it's anti-wrinkle injections or fillers elsewhere in the face, the minute someone sees the face and thinks, oh, where'd you get your lips done from? Even if they like them, there is part of their subconscious that is having a negative response. And this has been researched, this has been shown, even in the younger generation who have now, you know, young guys, 20, 21-year-olds, are basically the girls they know, a lot of them will have these overdone pouty lips. But they've done studies, because now with computer technology, you can just modify a set of lips, anything on the face, and then test it out again. And it's been shown that still there is a negative response from within when people see anything on the face that suggests the degree of unnatural. Now, of course, people could say, well, what about makeup? Well, cultural factors have to come in. So if there is a culture of women wearing lipstick, and things like that, it's fine. When you wear lipstick, I don't think you look more attractive. Okay, Alex? But when when a woman does, actually it's the right shade of, yes. And that's why when women wear too much makeup, and it's almost like a camouflage, like a complete block, you know, like you can't actually tell who's underneath. That's when the genuine factor goes down and actually attraction goes down. But the right amount of makeup will actually maybe help beautify, because it's just, you know, covering up small blemishes and stuff. So that is the basic thing. And you and I will try to tell patients that you know, no, what you want is not going to look right, but they're not going to see it. And the other factor, and I am going to come to an end and throw one at you in a minute, but the other thing is that when someone is looking at their lips, they cannot be objective, because they're looking at a two-dimensional image in the mirror or in a photograph. And if we just take one single aspect of the lips, which is this curve, I say to patients, I say, you just see a Cupid's bow, but it's not just a flat line. As it moves here, it's going backwards. So you've instantly got two dimensions, and then you've got this dimension. So the minute you start doing anything here, you're playing with three different curves. So you've got to have a very, very skilled, but to me, I think lips are one of the most difficult things to do on the face, because it, you know, and yet, were you not taught that as a beginner? I mean, I was taught that as a complete novice injector. I was taught lips, you know, years ago, and many courses now still teach beginners lips. And for me, I think that should be advanced training. And at our academy, that is going to be, you know, for experienced injectors, because you can, you know, what's the other area? Tear trough. People often say, oh yeah, and weirdly, most of the beauticians in the area, they won't go near tear trough, which is great. I'm glad they don't. But I'd actually be more scared to inject the lips, because, as you know, the anatomy of every person's lips is different. The blood vessels are different. Whereas here, you pretty much know where it is in each person. So I actually think this is the riskiest area. And I know I'm going to ask you something about technique in a minute. But yeah, in a nutshell, I just think if people understood the true psychology of beauty, how people respond at a subconscious level, maybe less people would end up doing that to their lips. But culturally, whatever's going on is going to feed into what people want. And if you're surrounded by these overdone lips, it feeds into your mind that I don't get my lips done, I can't be like that person with that many likes. And, you know, look at eyebrows. You know, 10, 20 years ago, culturally, it was perceived to have a beautiful eyebrow when women plucked them and had them nice and thin. Now, the same women who saw beauty in their face with thin eyebrows are now regretting that overplucking and are getting microblading and whatever else to get a fuller eyebrow. And now they see that as beautiful. This is the same individuals. So if enough is thrown at us culturally as a society, then it will morph how we see beauty. That's quite an amazing thought in itself. You can tell why I yap on ages to my patients. They're probably so sick and tired of me by the end of it. They're like, just do what you need to do. Fine. If you don't want to do lips, I'll believe you. Okay, let me throw one at you, Alex. Without mentioning brand names, this might link in with pricing as well, but there are so many brands out there. I mean, you know, I think over 200 are approved in the EU, but only about 15 odd by the FDA, something like that, a very small number in the US. And but there are hundreds and hundreds of brands out there. During the lockdown, the only brands I've been offered are the ones that are being injected in the local back streets and beauty parlours, being offered to me for ridiculous money. What's your take on brands, and does it make a difference?
I think it can make, everybody says, well, I can't remember what the phrase is, an artist doesn't blame his tools, or whatever the phrase is. But I think the fillers definitely do have a huge impact in terms of the outcome, in addition to the practitioner placement and skills. Because they've all got slightly different rheologies, which the non-medics here is slightly different properties. So some are thicker, some are runnier, some are more like jelly, some are more like honey, and you've got to choose the right product for the right place. And because some people want more voluminous lips, you'll need something a bit thicker to create the volume there. So I think in the quality products, so I'm talking stuff you get from reputable pharmacies, although you could say, oh, they're all just filler, there's actually quite a lot of differences between the different brands. Even inside the own brands, there's a lot of differences. I think my concerns are probably what you've noticed is, and again, I'm getting a lot of these emails coming through saying, oh, buy these fillers. They're so cheap, but they've got no clinical data behind them. You can't get access to the breakdown of kind of what they're made of. They don't have any CE marks. I know one of the brands was kind of stopped temporarily here being imported because they lost a CE mark, and they've had to try and get that back on again. So there's a lot of stuff that, from a safety point of view, is very important, but is often overlooked because people just see, oh, that filler's £99 down the road. I'm sure it looks fine, but they don't realise that once that product is in, it might not even be filler. I wrote an article in the Aesthetics Journal at the end of last year about people turning up to A&E. In fact, I think there was a case I posted on my feed today.
I saw it.
Some filler from the internet, and obviously no proper aesthetic companies injecting at the moment because we're not allowed to. So she'd self-injected her own lips. And I think, as I said in the post, I think we can sometimes make it look a lot more simple than it is. But I think people see us all just sticking a needle in and it's just like a straight line across and things. But I don't think they realise the complications, the depths, the vessels, the anatomy, and all the other things that we think of while we're doing it. So this filler for like £30 off eBay. It might be packaged off as like a big brand name, but I know from the companies that they've said that when they've had problems with these things, they've checked the number and it's not actually come out from the company. So they're just knockoff fakes. It might not even be filler. It could be silicone. It could be cooking oil. There's been coconut oil.
We've seen it all, haven't we? Some rather horrific cases.
It's awful.
And I think that's the thing, that if I unwrap a box, I can tomorrow. I don't want to pick on China, but a lot of these products do come from there. But let's say Far East or anywhere. But they say, and this was a Chinese contact actually, who said that if you bring a product out tomorrow, I can produce you a counterfeit version that you won't be able to tell the difference, cosmetically speaking, with a box and everything within 24 hours.
Yeah.
But these fillers, that when patients are coming in, I almost never hear them mention a brand that I would be willing to use.
Yeah.
And
it's very difficult to get. It's quite a popular one amongst the non-medics, but I think it's made of. I think it's got like some of the wax from like fruits in it or something, so it makes it very resistant to dissolve.
But they look, if you inject, I've got my hands on it, and if you inject these, they can look very similar.
Yeah.
So it can look, but actually, if you inject them into water, bearing in mind most of our tissue is made up of water, if you inject it into something, you can immediately see how differently they're behaving.
Yeah. And
so even if the person has been injected in the right plane, and you just touched on a point, which again, when ladies come in who say, I'm really worried about having my lips done, particularly when I say older ladies, I'm not saying old, but ladies, you know, in their 30s, 40s, 50s, 60s, you know, they're starting to get actual aging of the lips, even more thinning of the lips, maybe more lip lines, etc. Lipstick's not sitting properly. And they're particularly worried because they've been surrounded by these horrible images. And I say to them, I say, the thing is, if you have someone who has done, even if they've got a certificate, they've been trained by someone who shouldn't have been training in the first place. You know, I've only just opened an academy after having done this for years, even full time. I've done it for 6 years and was doing it before then. And I think you've got to get to such a level before you think, yeah, I can actually train other people to do this. And these people are being taught, and essentially it's just shove a needle, and it's like if it's an empty bag. And as you've just said, there are so many different planes. The analogy I give is, if you put a bath in your lounge, it's going to be no good. And the face is treated like one empty sack where you can just shove the filler in the cheek, shove the filler here, and then no wonder people are looking distorted and they don't look natural. And I talk about subconscious mind and conscious mind. Some people say, oh yeah, no, you know, it looks fine. You think, yeah, you're looking and you can't see anything obvious, but people are subconsciously going to pick up on little tiny cues that there's something not quite right with your face. And you and I, we've all been in a group where you pass someone, and then someone in your group who isn't a doctor, doesn't do aesthetics, says, did that person have something done with their face? And immediately something is triggered at a subconscious level, that there's something not human about that face. And that's the thing with the lips, is that I do that. If this doesn't, you know, how many people get filler shoved here when they shouldn't have it? And it kind of looks like a lion face, doesn't it? It kind of looks slightly unhuman. And immediately you switch off beauty, you don't add beauty. And I think, I'm going to stop ranting in a bit, but I think ultimately, the only people I will treat are those who can come in and actually just say, you know what, yeah, I understand what you're saying. And I say, all I'm going to do is to add beauty and therefore confidence to you. That is it. If I'm going to do anything to your face that's going to do the opposite, then I've failed. If someone looks at your lips and says, wow, I love your lips, who did them? I think I've still failed. I want them to say, wow, you're looking really hot, you're looking really good. But it shouldn't, nothing should draw you in, right? Yeah.
When it's done and it's not done in a natural way, the other person, the person looking at them, speaking to them, you're just drawn into that. And whether you don't mean to, you'll probably find that people's eyes are always like just looking down at your lips, not because they're kind of reading what you're saying, but because they can see that something isn't right, and it's distracting. People end up drawn to these unnatural looking points, but not in a good way. So you just want something that you just look refreshed, and I guess that's the best way of putting it. So how much do you think the responsibility lies with us as injectors to kind of say no or stop, or you've kind of reached the limits of natural and anymore, and you're going to go into the too much look? Should it lie on us, or is it mainly just a patient that should kind of take the responsibility for that?
I think it's with us, because, you know, as doctors and, you know, nurses, dentists, but, you know, as medical professionals, we have a code of conduct. We've got a professional obligation, ethical obligation, you know, and I know one of the ethical pillars is patient autonomy, isn't it? But one of the other ones is also do no harm.
Yes.
And now the patient insisting on more filler may say, well, no, you're not going to do harm because I'm going to love this and this is going to be good. But if I know that genuinely I am going to de-beautify them, whatever they think, and actually I've talked about actually how it does, you know, someone's not going to know the impact that's had on their life, because how do you measure that? Yeah, the negative impact. So, you know, and they have a choice to go elsewhere. You know, ultimately, if I've only 3 or 4 times had to say to someone, I'm afraid I'm not going to be able to do that. And if that's what you want, I'm not the person for you.
Yeah. And
actually, would you believe when you say that, each time they've said, all right, fine, well, I'll just go with what you're saying. But, you know, I mean, so the patient has to come before profit. And if I've really got their best interests at heart, then it has to be with me. I did meet one medical professional who actually said, and sorry if you do this as well, but who gives them the mirror. So I don't actually even give. I have done when we've been doing videos because it's quite nice to see their reaction on the couch. But normally I don't give them a close-up mirror. I let them walk to the main mirror. Yeah, and I get them. Yeah, but he actually gives them the mirror and says to them, "Do you like them? Would you like any more? How do you?"
Yeah. No.
How we've just said, well, you swell immediately for a start.
Yeah.
The person can't see in a mirror; they're seeing a four-dimensional thing, if there's such a thing, in a two-dimensional image. They've got anesthesia working, so we know if you're numb, your brain sees a different image. And he's asking them if they want more. So, you know, so the answer is absolutely no. And interestingly, you used to work in A&E, I used to work in general practice. And over the years, the biggest change, when my dad was a GP, you came in with a cough, he was like, right, you've got a chest infection, that's you, off you go. Now right, your cough may be one of these things, these are your options, this is what I think, what do you think, you know, blah, 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 and eventually you come up with a decision.
Yeah.
In aesthetics, I think it's gone the other way. 5-6 years ago, I wasn't totally doing it, but there was a bit more of, oh, you want it here? Yeah, I think that would work. Boom. They then look in the mirror and go, oh yeah, my lips are bigger, you're great. But actually, did the world see a more beautiful face? Not always. Now we understand the whole face, anatomy, aging, the relationships more. We understand beauty so much better, don't we, in the last 5 years? So we're doing, you know, I used to do sort of 2 temples a year. Now I do probably 3 temples, 4 temples a week at least, if not more. You know, chins. I barely did chins. And you would just said, now I'm doing just as many chins. I'm doing lips, probably more. So now we understand how we can really beautify with small, subtle, multi-location changes rather than lots in one area. How can we possibly be guided by the patient? Because they don't have that knowledge. And it's not going to sound patronizing, but as this change and this increase in knowledge, as we've evolved as practitioners, yes, we can impart some of that to them, but then ultimately more of the decision has to rest with us. And that's why I ask patients, do you trust, do you understand the message I'm giving you about how I'm assessing you and the subconscious factors and beauty and blah, blah? Yes, right, then leave it with me. Just leave it with me. If you want to spend £250 today on lip filler, let's just say you're spending $250, but let me decide how that's going to go in your face, because all we need to do is make your face more beautiful.
Yeah.
And that's why, as I said to you the other day, I send a video out now to patients before they come in, so they're already primed with what they're going to be told by me. It's a lot more hard work. You know, 5 years ago, it was like, yeah, that's what you want. Here you go, off you go, bye. And now you've got to really impart that knowledge onto them, because otherwise they're not gonna be convinced by what you're doing.
It's difficult to, because we've seen like hundreds of I don't know, probably thousands with you of cases. So they don't have we've seen everything through from start to finish. And again, with all the education that we do and the techniques, we kind of know more what to expect from a certain patient and a certain result. Yeah. And I think that's why it's important to kind of relay that to them, because I think in their mind, it might be that they come in with sort of 0 lips and then come out like Angelina Jolie, and they think that one syringe will do that, just from stuff they've seen online, which are quite often sort of kind of false advertising, really. So I think it's important to we can't impart all our knowledge onto them, but it's why important, I agree, to kind of try and get them on the same page at least, so that we can guide them, because we're the people doing it. We know what works well and what doesn't work well, whether that's through experience or shared cases or things.
I'm Elliot. Hi, Ingrid. I've been saying hello to quite a few people there, but we'll. Sanjay, hello. How are you doing? Denise, Sophie, Paige, hello to everyone. Thanks for joining. And one thing, just whilst we're doing that, before we move on, is that, you know, like Steve Harris, calls this the door to the face. Maurizio, I've heard him call the lips almost like the painting on the wall. I often, I'm not the only one, a lot of us in aesthetics talk about the face like a house.
Yeah.
I talk about it like an upside down house. So this is the foundations. I want to start at the temples. Here, you can even demonstrate changes to the corner of the mouth by doing temple fillers, and then work down, unless there is significant aging here compared to everywhere else, and you might need to do a little bit of work here. Depends on how much product you can use at the initial sitting. But the lips, yes, it's central. Yes, 10% of gaze is spent looking at this area. 90% of our gaze we spend looking at someone around here. But some patients will disproportionately put value and importance on this area, where actually we have to do something else. And when I mentioned earlier about looking natural, harmony is the key thing. So if on my car I've got a massive big dent, and I turn up to the garage and say, I've got this little scratch here which I really need you to sort out, he's going to say, mate, but you've got this big dent in your car. Why are you doing? So, and sometimes we lose sight of the bigger picture because, as I said, culturally, if everyone's talking lips, then it must be lips. Surely it's lips, because everyone's going on about lips. I know I'm going off at a tangent, but this is one point that I can't get over, and I hear a lot of, Alex, if I can. I'm going to give you an example. I was seeing a patient of mine with her husband. Both have had a little bit of filler work done, in their 50s, beautiful couple, just a bit of freshening up. And I did the lady's lips, again, very, very apprehensive about having lips done. She's previously planned to have it 3 times and cancelled. And luckily, she let me do a few other things first, and then let me focus on the painting on the wall. So structure, foundation of the house, all the key work, and then we did the niceties here. Nice, subtle work. It was, I think, 0.5, 0.6 mils to lift a little bit, do a bit around here. It didn't even all go in the lips, and then a little bit in here. And she was really delighted, and she said, oh, one of my friends, she's got these awful lips. She's been to, and they just look awful. And I said, well, what did she say when you told her that? And she said, oh, I wouldn't possibly tell her. And I have had this a lot, even from people who are close to me, whose friends have, look a bit, and they're like, oh, I couldn't tell her. That she'd be just, dismayed if she, really, really upset. And that bothers me, because if you don't love someone enough, who is your best friend, this woman, it was her best friend, but I've heard this a lot.
Yeah.
To be honest and to be the one, because if you're not going to be honest, who is? Then you're essentially, what you're saying is you're happy for them to walk around life and society with a set of lips that other people are also going to perceive as negative, and therefore is going to impact on their life in a negative way. Relationships, at work, whatever. If they're in a job, they're trying to sell, in their job marketing, they're going to sell less. The research is all there, the evidence is there. Yeah. So I wish people would just be honest to the people they're closest to. Now, clearly, if you don't know the person well, it's not appropriate. But people need to be honest with the people they're close to, because I've heard this a lot. My mate, but I couldn't tell her. And so that person is then just fueled by this perception and belief that I have got beautiful lips. I was in a bar once, and I saw a girl whose lips were pretty disastrous, and I was just kind of quietly watching, and she went to her friends, and a couple of other friends joined, and they went, oh, you've had your lips done. First sign. And she said, yeah, what do you think? And she said, and they were like, yeah, they're really nice. And she went, yeah. And as she turned around and walked to the bar, they looked at each other with a look of, these were her friends, her apparent circle of friends, who just told her to her face, your lips look lovely. But when she turned around, they were like, oh, God. And I heard a couple of guys later making some negative comments. So I think we all just need to be honest with each other and say, look, this is not good. Your look isn't good. You saw an after photo the other day, I have, where we thought it was a complication being shown on the internet. And it was a practitioner advertising their great after results. Hi, Amit. I mean, what the hell? What the hell? This is what we're surrounded by. So for those ladies who just want, you know, I just want a little bit of, it's possible. It is possible, but you've got to go to the right person. If the person injecting you doesn't look right, doesn't look natural, walk away. Walk away, because we know they exist, and they've clearly got, you know, whether they've got a little bit of dysmorphia or whether they've just got, you know, if they can't even see that, then they're probably not going to be able to see your face in the right way. And you and I see that at conferences, which is sad, you know, where people who should know better have just gone too far. And why is it? Because they've just kept treating, and everyone's vulnerable to it. And that's why I will be, you know, I would always ask a colleague, someone I'd respect, to say, hey, have a look, what do you think? What do you think I should do? What do you think I should do? And I think this self-injecting and self-treating can just end up taking people down a slippery slope. But I'm going off on a tangent.
You end up with like a very strange shape.
Absolutely lucky.
Looking in the mirror, you might look all right. And then when you turn to the side, because you can't see it very well in 3D, you'll end up like with all, I mean, it's part of the reason I like the conferences, just to see what people have actually done for themselves. It's awful.
The number of ski slopes. The other thing is many practitioners post their immediate afters. Fair enough, because you may not see the patient again, and they might look okay, often don't. The thing is, with a lot of these people, they're injected too deeply, they're not injected correctly, the product migrates. 6 weeks, 2 months later, they've got this swollen, edematous look here, a little bit of a ski slope, but that after photo will never go on their Facebook page or whatever else. And, you know, I've got 1 or 2 key people locally whose patients I keep seeing, because they're clearly doing something wrong. But when you go on their Facebook page, you won't see these. My last complication I saw, she actually said, oh, do you want to see the video of me being injected? And I said, all right. She said, yeah, she's put it on her Facebook page. But it was a complication in the end, and interesting, but it allowed me to see what technique had been used, which is actually quite lucky. In fact, let's talk about dissolving, Alex. How often do you have to dissolve? What sort of percentage of dissolving treatments that you do with
a massive percentage of dissolving. Part of it is when people do contact me, if possible, ideally the original injector should actually be doing the dissolving, because they kind of know the level that they've injected out, they know the product that they've used. But like I said, from that article with 83% who kind of just bounce it back, they might not be able to, they might not have the high layers of the dissolver, they might not know how to do it, and then they kind of get left in limbo, and that's when they come to us. So often I'll see it, because obviously I'll end up charging them to reverse somebody else's, or if it's not an emergency, so it'd be cheap for them to get it sorted with the original practitioner, and then it feeds back to the original practitioner that, because if they all had like a bad result and then came to me without me feeding back to the original practitioner, the practitioner would think, oh, this is great, I'm having no complications, but actually they've lost that much confidence in the initial injector that they don't want to go back to them. That's something I see quite a lot of it in the people that come to me for the dissolving, is that they just don't feel confident in that person anymore, or safe, or maybe they weren't quite as medical, and they feel that because this is a complication, they feel like they need to go and see a doctor or somebody who might be slightly better to deal with it. I'd say I get a fairly even distribution, tear troughs, nose and lips. And jaw. Okay, so I don't think I've got one more than the other. It's actually creeping up now as jaw. They're all getting this snatched Kim K package and things, where regardless of gender, regardless of the face shape, everybody gets certain number of mils in the exact same spot, certain number of mils in the chin, male or female. Again, it doesn't always suit their face shape. And a lot of them come to me afterwards and like, oh, I wanted my face to look slimmer or come up wider. So I'd say actually for me, probably more so than the lips, it's probably this year, before pre-lockdown, was probably starting to be jaws that were the most.
Okay, that's interesting. And I guess regional changes, there'll be regional variations as well. Certainly at my clinic, it is almost always lips, a handful of tear troughs, but it's lips because so many people who shouldn't be injecting lips,
Yeah.
lips, 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 lips. You know, they get them in, out quickly, just jab, cheap product. And of course, if something goes wrong, who is that person going to be reported to? No one. There is no regulatory body for them. So, you know, people are just idiots for going to these people. It doesn't matter how cheap it is. You know, ask yourself, you know, is it worth it?
Yeah.
I was going to stop doing complication management from anywhere else because it was just so difficult. You can never get information. I've only once, have all the complications I've managed, been able to successfully get the clinical records and information from the practitioner. And that was a pharmacist, because now pharmacists have started injecting, wasn't able to dissolve, and so did the right thing, referred the patient to me, and actually paid for the patient to see me, which was quite nice. But the average beautician or anyone else around the corner, they're not going to do that.
No.
And they're often not contactable. You know, and there's only one mode like Facebook. They're blocked on Facebook. That's it. Patient can't contact them. And it is generally lips. And I have to say, I'm actually going to post a little case study in the next couple of days for someone we saw a couple of months ago who had it done. And you know, usually we have been able to correct, but there's been a few that have been, you know, I've been really worried, you know, and thinking potentially there was going to be some tissue death, and you know, that they'd have to go to the plastic surgeons to see, you know, what, I mean, that's permanent disfigurement, obviously. But yeah, so let's talk about cannulas and needles. I had a question about that, and you and I differ slightly, but I know you only use a cannula in the lips, right?
Primarily, maybe occasionally I will cut the needle, but I prefer. So when I started out, it was needle technique. So I changed as I've gone along. And like you were saying at the start about people thinking tear troughs are like the hardest bit. Again, for me, I felt lips were terrifying, actually, to be honest, because there's just so much that can go wrong. You've got no room for error as well, because it's not like cheeks where one side is bone, so it can only push out in one kind of direction. The lips can push out against all sorts. So I eventually just switched over to cannulas. I felt it was just a little bit safer at that point. And then actually when I switched, I was getting some really nice results. So I ended up sticking with it. But there are some times that I still will get the needle out, and I've still occasionally will flip between the two. So I'm not a sort of cannula or nothing, but cannulas, the majority of them, probably my number one reason is probably safety. But then after that, I did find that the results, just because you can get like a nice straight extrusion in a straight line, I feel you're less likely to get little lumps and bumps appear. But then equally, for things like the vermilion border, you might not get quite the same sharpness because you use like a 25 gauge cannula, try and slide, which you can't quite get the sharpness you can sometimes get with a needle.
Yeah, I think if I colleagues of mine who I've done training sessions with or things with, who are, you know, I'm thinking of certain names respected globally. Even within them, there are differing opinions, and as they always say, it's not right or wrong. It's if you've got the skill and experience to use the needle, and you know, it's all about ignorance, isn't it? If you don't know. If you don't know what you don't know, you know, Jahari's windows, then ignorance is bliss, and you'll happily just jab people's lips and go, yeah, crack on, next one, please. Whereas you or I, with every complication management session we go to, with every lecture, conference, you know, probably 1 month of my year is taken up on professional development and education. You then go, oh yeah, you know, and it makes you more wary of these things. So I kind of do 50-50. I often do use cannula. For the border, I always use a needle still, and then for the but I often sometimes do, you know, if I just want to, I feel I can be more precise with a needle, but at the same time I can get really nice results with a cannula as well. So you're right, I think it's just knowing that when you are using the needle, you mitigate against the theoretical increased risks of using a needle, being in a vessel, by doing certain things. You know, again, the number of times I've had patients come in and say, yeah, she jabbed me like this.
Yeah,
And,
yeah.
you know, and you just think, well, you're asking for a big, you know, blue, you know, big venous.
Jabs.
Yeah, absolutely.
Risk going into a vessel with that, it's terrifying.
Yeah. So yeah, I think if you compliment your technique, I mean, I do my needle technique here actually very superficially. It's actually very superficial, and it's nice. Again, that comes down to the product you use, because you need that good tissue integration.
Yeah.
If you use a filler that's not, aside from a little bit of lumpiness you can get in the first few days, the person's going to come back and say, I've got lots of lumps.
Yeah.
Whereas really that should be quite rare. It can happen, but quite rare. So for people who are new and they want to go and get it done, would you agree that, I think, you know, little to start with? I think they're more likely, some of those patients are more likely to come back after 2 weeks and say, I think it's all gone. So I often talk about perception drifts. Sabrina Febby in San Diego, I think she is. She published a paper with colleagues last year on, or was it this year, on perception drift, where you very quickly can get used to your new look.
Yeah.
And you've had it with Botox, right? When patients come in and say, I don't think it's done that much. And you show them the before photo and they're like, oh my God, was that me? And so I explain that to patients, say, look, today they'll be swollen. If they look overdone to you, brilliant, because they'll probably look just right in a few days.
Yeah.
And occasionally you'll still get the panic caller the next day and you say, don't worry, it goes down, it always does. And if you think they look perfect when you walk out, you're going to be a bit disappointed in a couple of weeks.
Yeah.
And you might even say the filler's all gone. And that's why the psychology is so important, drumming it into them, saying no, no, no. And that's why taking that photo is always important, because then you can show them and say, look, something's happened. But it does have to be subtle, because then they want to look natural. That's how it's got to be, small bit.
To take out again.
What do you do for these lip lines here? How do you deal with those? You know,
so I suppose it depends a little bit on severity. I'll either cannula sort of subcut under the skin here, if they need a sort of general, if they've got a bit of general loss. If it's not too bad, then again, I'll just sort of focus again a bit on lip volume, just to stretch it out a little bit. And that usually does the job. I've started to use a slightly different product. If they, again, it's trying to educate people on the reason why these lines have happened. So quite often to ladies in their sort of 50s or 60s, I'll say, right, so to really kind of treat these, you've lost some volume in your lips, you need to have a bit of volume replaced, so you kind of help stretch them out. But oh no, I don't want lip filler, I don't want to look unnatural, I don't want to look like Leslie Ash. I think everybody kind of from that era has kind of got Leslie Ash imprinted on their brains. Yeah. Some of them will just not let you touch their lips, no matter how much you try and kind of tell them that it's going to look fine, it's going to look natural. So in those, I'll use, I'm just trying to do it without naming a brand, but I'll use on specific design for very superficial lines and wrinkles, which is quite nice, just if they're targeted ones. But in general, the best thing to do is just restore the volume that you've lost and just try. But again, it's not about augmenting, it's not about giving them a different set of lips, it's just turning back the ears to kind of where they were.
That's just it. That is just it. And I think once that message is across, and you've hit it on the head, that if I'm saying to someone where I'm doing anti-aging treatment, I'm saying your lips have aged like everything else. They've thinned, they've turned in. We've got bone loss. We've not mentioned bone loss. How many things can we talk about? There's bone loss and bony changes in the structure of the face. So if we ignore the lips at the same time, then we're actually not doing a holistic thing. So all we're trying to do is take your lips back maybe 10, 15 years, which will suit your face and fit your face. And that's one way I put it. I say it's a 55-year-old, I'll say, look, if I took your lips that you had when you were 40 and put them on your face now, would you be happy with that? And they go, oh yeah, that would be amazing. I could wear lipstick again. Well, that's what we're going to do. That's what we're going to aim to do. And sometimes though, if I'm talking to that person, I'm saying, but to do that, I need to start by working on some of these bony changes. I need to change some of the structure and support for this area, and I can't just go shoving in there. And definitely for the older patient, the aging factor needs to be addressed. For the younger patient, they might say, well, I'm young, why do I need anything else done? Well, because genetically you may not have the ideal mathematics of the face, and if your lips back here, your chin's back here, and your lips come out more, then not a great look. Not a great look. Leonardo da Vinci said, "Saper vedere." I've got it written here, knowing how to see. And I think that's the biggest learning aspect for me over the last 5 years is 5-6 years is the more I've done, the more you learn to see. You see things that you never saw before. Yeah. And when you do, it allows you to see what the person in front of you is not going to see. Even sometimes when you tell them, I need to do your temples, I need to do your chin, they're like, what are you talking about? Why would you do my temples? But then when you do it, then they look in the mirror and they're saying, okay, now I understand. Yeah, I see what you were saying.
The patient puts their trust in you to follow through your plan and just lets you kind of do what will make them look more attractive or turn the ears back a little bit, when it might not be what they've come in with. Again, tear troughs is quite a common area. They'll be like, oh, I've got some hollows in here, but the cheeks are like they've kind of caved in on themselves, and it's actually, well, really, we need to start again building some scaffolding, some support under your eyes. But they just see the hollows here, and because you can't necessarily see the loss of volume projection or the droop, then they don't really see it, and they're like, well, why do I need stuff in my cheek? So it's the eyes that I'm bothered about. So it's just trying to educate them on seeing the whole picture and not just focusing on one area, because that's what aging is. It's global loss, or some hyperexpansion, some fat pad, some loss of the bone. I mean, dentition might change as well. You've got so many factors that come into play. You can't, if you just focus on one thing, you're missing the bigger picture. And that's what I think probably as medics, we maybe do slightly better instead of just saying, okay, here's a transaction, you come in for lips, here's my £90, there's your lips, bye. I think we kind of see it more as kind of a global restoration, more holistic kind of health improvement sort of thing, rather than just pay me. Go.
And I think the other thing is we're ruled more with photographs. You know, people come in and say, oh look, I want to show you this photo, I want to show you this photo. Instagram still is very much photos, you know. Videos are coming, and life is not, we do not live life in society as a still shot. We are dynamic, we are moving, and you know, so if I'm doing lips, I'm getting someone to smile. I'm looking at the dynamic after I've done, although there's going to be some numbing agent, so it slightly influences movement. You know, again, I'm saying smile for me. You know, how does that smile look? How does the dynamic smile look? And that's often the giveaway. You see someone, their still shot may actually look okay for their lips, but the minute they start talking, you can see that there's something unnatural inside this gut. The beauty sensor goes right off, right off. Look at Nicole Kidman, great example. I don't know if we can say, oh, who cares? Nicole Kidman, right? When I was growing up, she was one of the stars guys talked about at school, and kind of, you know, older guy, you know, like, oh, Nicole Kidman, she's beautiful, blah, blah. And now, you know, that if she hadn't been so overdone, the same people would be talking about her. But, you know, over Botoxed or whatever product she has, you know, too many anti, totally frozen, overdone cheeks, nothing moving. And so that thing I talked about at the beginning, the genuineness, that's completely gone. There's no genuineness. Looks very disgenuine when she smiles because there's absolutely nothing happening anywhere. So yeah, she hasn't got any wrinkles, but some idiot or idiots are injecting her and treating her in a way they shouldn't be, maybe because they don't want to lose her, you know, they don't want to lose their celebrity client. So Alex, we've got
connection. Oh, we've got
20 seconds, so
should reconnect.
Yeah, we're gonna have to. So thanks everyone for joining. Maybe we should do another one soon, Alex, but we're about to lose everyone in 9 seconds. It's been fantastic. We've covered loads, and I hope it's been useful for people.
See you later. Bye.
See you later.